Are you sneezing a little bit more lately? Are your eyes watering a little bit more lately? Do you have a little bit more of an itch in certain spots lately? It may well be it's that time of the season. See, that would have been a much better song to introduce this segment of the program. Jeremy Daly joining us in studio. He's a physician assistant from Tripp Family Medicine here in Twin Falls. This portion of the program is called on Wednesdays between 8:30 and 9 o'clock. Better Health with Tripp Family Medicine, and we talk usually about something very topical, and today that would be the case. And Jeremy, I want to welcome you back, of course, first of all, but I had to laugh because on the list of things we're talking about today, it mentioned that you have just been swamped at the office the last couple of days with people who are having allergy issues. Let me handle your microphone there first.
There we go.
Yeah, you're perfect.
Okay. Yeah. Appreciate that, Bill.
Yeah, it's a little tough to get the expert on the air when you can't hear him. So go ahead.
Yeah, that's something we've been seeing a lot of lately, and we do expect it at this time of the year. April, May is when we see a lot of blooms, especially with trees and things like that. So, um, it's been something that I think a lot of people they say, well, flu season, is that still going on? Or am I getting a cold? Or is this allergies? And so I think a lot of people they want to know, well, how do I know the difference between allergies and the flu and a cold and things like that? So those are some of the things that we want to talk about today, and specifically some of the treatments that people can do on their own. And if that's not working, then things that they could come into see us for.
You mentioned on your own because over the years I've generally been able to just use something over the counter, but my sister, on the other hand, has usually had to have some sort of a prescription medicine. Now, physiology differs between people, and I think we both have allergy issues. Hers just seems to take a bigger toll than it does when I have issues, and so that's why she has the I guess the stronger, more potent varieties that she uses.
Yeah, definitely. Everyone responds to allergens in the environment differently. Some people they get a little bit of a runny nose and itchy eyes, and some people they seem to just drip constantly all day long from the eyes, the nose, and stuffy ears, itchy throat, and it's something that it really affects their quality of life. And I think a lot of people say, "Oh, it's just allergies," but it really does affect a lot of people's quality of life. It's tough to work when you're feeling that way. It's tough to um, do things outside, frankly, when you're feeling that way. As far as taking care of your yard or going to recreate on the weekends, it's really difficult. So it's something that we take seriously, and try not to minimize. Oh, that's just allergies. Just take a pill and it'll be done. Because sometimes that's not the answer.
Sometimes it also will attenuate. I know that when I was a teenager, I'd be out doing some clearing brush, doing some field work, and I'd get to the point where my eyes would literally, they'd swell shut. And if I went to somebody's house and they had cats, I would have similar issues. Now I have a big furry cat in the house, and I don't have any of that happen. And so some of what I used to suffer from doesn't seem to be anywhere near as bad as it was when I was a teenager or in my early 20s.
Yeah, definitely. If you look at the statistics on the demographics with allergy, it's really, you know, young people that suffer from it the most. Um, the adolescent and teens into the 20s is when people seem to have the worst symptoms for allergies. But we still do see a lot of people that come in their um, later later decades of life, and their symptoms are just as severe. But statistically, those are the people that we see the most. So
I was going to say too as well. Is there a difference between men and women? I mean, does one sex over another have more difficulty?
no, there's no statistic to support that. I would say it's pretty evenly matched. Um, you know, we probably see an even amount of men and women come in, and there's not really any correlation between gender and severity. It's really just the luck of the draw when it comes to genetics. A lot of it is family history and the way that your family responds to certain types of allergens. So there's a lot to it, but you know, for the most part, it's just luck of the draw. There's
Well, how do people tell the difference? Because we still have a few stray cases of flu, for instance, that this is not the flu or a cold. How would you know? I mean, in this situation.
Yeah, I think that's a really good question. A lot of times it's the duration. Most of the time, if it's seasonal allergies, it's not going to go away after a week or two. It's just going to kind of linger, and it's like, oh, why is this cold just lingering here? And we a lot of times see the absence of certain symptoms, like body aches and chills and fever, and it's just this persistent runny nose or sore throat from that we call it postnasal drainage, or all that um, nasal secretions that drain down the back of the throat. And so, it's sometimes it's time that tells us. And you know, one of the big differentiating features between a cold and flu and allergic rhinitis, as we call it, is the amount of itchiness that you have. Those aren't features that you typically see with a cold or the flu, and those are really related to histamine. Histamine is this nasty chemical messenger that our body releases when we're exposed to certain types of allergens. And so, you know, when we're exposed to those, our body releases all this histamine and we just swell. We swell in our nose, we swell in our throat, and we feel awful and itchy.
We've got more on that coming up back in just a couple of minutes, and how to treat that too as well. Jeremy Daly joining us. He's a physician assistant at Tripp Family Medicine. It's Better Health with Tripp Family Medicine this morning on News Radio 1310 KLIX, newsradio1310.com, and Bill Colley answering the telephones for Jeremy. 48 on our way to 79 today before it's all over. Jeremy Daly joining us in studio from Tripp Family Medicine right here in Twin Falls. We should point out Tripp Family Medicine is located on Fillmore Street on the north end of the city and directly across from the main post office. In fact, just around the block from Pole Line Road, because they're always looking for new patients, and people who'd like to know where exactly it is in relation to getting there conveniently should know it is in a very convenient spot. And we want to point out, Jeremy, we'll take some of your telephone calls too as well if you're suffering from any specific allergies or you're not quite sure specifically what you're suffering from. The telephone number is 736-0300, 736-0300. Bill Colley with you as well on News Radio 1310 KLIX and newsradio1310.com. You referenced the histamines causing so many issues. Well, antihistamines, I guess, are the most common response to that, right? And some of those are over the counter, and some are a little bit more stronger in their prescription strength, right?
Yeah, exactly. I would say most of them are over the counter, and um, we look at them in certain generations. So the first generation antihistamines are a little bit more sedating type medications. In pharmacology, we call those dirty drugs. That means that they do a lot more than one thing. They hit a lot of different types of receptors, and so that's why you see a lot of um, sedation type side effects with Benadryl and things of that nature. They're great for allergies, but they also make you feel like you want to take a nap. So not great for the workplace. So if people are suffering from what we call mild, persistent allergies, basically where they're having the runny nose that just won't go away and a little bit of itching, we recommend a lot of times these second generation antihistamines, which is more of the Claritins, the Allegras, Zyrtec is one of the second generation antihistamines, which are supposed to be less sedating, excluding Zyrtec, which has some kind of sedative properties to it. So people will feel a little drowsy during the day when they take that type of second generation antihistamine. But really, when it comes to the mainstay treatment of allergic rhinitis or seasonal allergies, it's the literature is really starting to suggest the best thing to use is a nasal steroid. So there's a lot of really good nasal steroids out there. Recently, one just went over the counter. It's called Flonase. So that's one that we
I
a lot
see
of
that on
times,
TV a
yeah,
lot. Yeah.
they're really pushing it right now. That over the counter marketing, and it's an effective intranasal steroid, and so we recommend that one quite a bit if we're not seeing really good results with those antihistamines, and then from there we can kind of escalate. We sometimes try other medications that deal with a different pathway other than a histamine pathway. It's called a leukotriene pathway. So those medications are like Singulair, if people are familiar with those. Not quite as effective as the first generation uh, or the first line medications like the antihistamines or the intranasal steroids. And then sometimes when they get bad enough, we'll even do things like an allergy shot, and something that has been done for a long time. And we do it, once during the season, and it will last sometimes several months for people that suffer with what we call refractory allergic rhinitis, where they just can't seem to calm it down with the over the counter treatments or the less I guess aggressive treatments, you could say.
I can remember working out, as I say, clearing brush when I was younger and doing some of those difficult jobs that always seemed to get assigned to me as part of my household chores. And after a few hours, I would end up with also the machine gun sneezing, which I could deal with a little bit of swelling around the eyes, but the sneezing, that kind of that'll incapacitate you at a point. And I would often go inside, and my response would be to take a wet washcloth, wipe my face down, rinse the washcloth off, and then sort of try to breathe through it too as well. And that seemed to eventually bring the sneezing to an end, almost filtering it.
Yeah, I guess that's a great way to filter. Can't do that all day long, but
No, you can't.
it's something you can do temporarily. Um, so I mean, most of the time for people that suffer, it's knowing the triggers, and obviously that was one of your triggers.
Right.
So you probably tried to get out of that job as much as you could, right?
Yeah, well, it didn't work out that way. uh, for a lot of people too, we see a growth in allergies, and I know there was a theory I read about it in Atlantic magazine years ago that we have raised people in such sterile environments that we can be too clean any longer, and because of that, we don't have an ability to build an immune system that can really combat a lot of these allergies, like perhaps we used to when people had more pets around and maybe lived on the farm and you were always around these things growing up.
Yeah, yeah. I've read a lot about that as well, and it's something that I think has some validity to it. I think that you know, years ago you probably didn't see this amount of allergies or even colds and flus and things like that because we live in really sterile environments. I mean, we're really good at using these uh, sterile wipes and sprays, and which isn't necessarily a bad thing. I think we help to reduce disease transmission in a lot of ways. But early on, kids really don't get the exposure they need to certain things, and they tend to be sick a little bit more because of it, I think.
And we're dealing with environments today where we try to protect them from a lot of these things. I know people won't even have pets around the house, but those were things if you grew up with them, you don't usually end up with pet allergies at 15.
Oh yeah, exactly. I mean, if you think about 50 years ago, how many restaurants allowed people to smoke inside the restaurant? There was the smoking section in the restaurant, which really meant the whole
Yes.
restaurant smelled like smoke. But people would eat. Almost every restaurant had a smoking section, and so people would be exposed to that on a regular basis, even if they weren't smokers. And that's a really common trigger for people. I think animals is another good example. A lot of times, we limit exposure to certain things, and I think because of that, we are a little bit more hypersensitive when we are exposed to those.
Now we have some there's some serious issues with this too as well. We need to mention it's 10 minutes away from 9 o'clock, and of course Jeremy Daly, physician assistant, joining us from Tripp Family Medicine right here in Twin Falls, News Radio 1310 KLIX and News Radio 1310.com, and Bill Colley answering the telephones. There are people who obviously are going to have some serious health issues, and sometimes some of these allergies they'll close airways and the like, and that's where you really get concerned as a medical provider.
Yeah, definitely, especially people who have history of things like asthma. This can be a really big exacerbating agent. Something that's going to make it worse is the allergens that they're exposed to, and if they don't take care of it properly, and they start to get a lot of bronchospasm, where the tubes, so to speak, that go down to the lungs are closed off. They become a little less open and more inflamed, and the airway can eventually be cut off completely if it's not taken care of properly. So that's something that we definitely like to look out for, and we like to treat early on so that we don't have to deal with the late effects of severe asthma.
In fact, I think I was 16 or so when I met my first neighbor who had issues with bee stings, and if she'd get stung by a bee, she would have to take an injection, and that was like a steroid, right? And she'd be up all night because of it.
Actually, it's a epinephrine injection, so it's like pure adrenaline. And yeah, we do that a lot of times when I worked in the emergency room. Uh, we would, on more occasions than I would like to have done it, we would have given patients injectable epinephrine just to abort these really severe allergic reactions, and keep the throat from closing off, keep the respiratory tract from closing, and really help them to start breathing again, and not go into what we call anaphylaxis, or severe allergic response that can sometimes cause death.
We have a caller with us. You're on the air with Jeremy Daly from Tripp Family Medicine at 8:52. And what's on your mind?
Yes, I was curious to see if they've had any progress on finding what causes hives. I've had a case of hives for 27 years, and I can only keep them at bay with taking over-the-counter medication. And I was just curious to see if they've had any advances or anything in being able to finding the cause of stuff like that.
Now, were you diagnosed with like did they say it was an idiopathic urticaria? Is that what?
All I can say is I know that I just have hives. And they did some testing years ago and said that was just the hardest thing to pinpoint. Beyond that, I really don't know.
Well, that's a great question. I mean, hives are usually due to some sort of allergic response. So, most of the time it's histamine related, where you actually get swelling in the skin. A lot of times it's due to exposure to something, right? So we talk about something that we breathe in, something that we eat, something that we touch. All of those things could be potential causes of things like hives. Um, there are some cases that basically they're called idiopathic urticaria, meaning we don't know why you have the hives. We don't know why those are going on. Um, but before we actually call it that, we like to do a lot of investigation. You can do allergy testing. There's a lot that are done via skin. Um, so we basically prick the skin with certain types of um, allergens and see what the response is. And there's a lot of blood tests that can be done as well that do a really broad spectrum of allergies to see if there's something specifically that's causing that. And so, before we give up on it and say, well, it's this idiopathic urticaria, we say, well, let's investigate it first. So that's the first thing I would say. If that hasn't been done, that's the first step. And you know, if if it hasn't been done in a long time, then maybe it's time to do it again. So there's a lot of really good resources out there, and I wouldn't just give up on it and say, well, I'm doomed to take this every day if you can find the actual causative agent of those hives.
Right. Okay. Thank you.
Yeah, no problem.
I want to thank you for the telephone call on the number 7360300. Before we move along, too, we should point out contact information at your office as well for people who'd like to know how to get in touch with someone there.
Definitely. So you can get a hold of us at 933-4400, and you can catch up with us on Facebook. We have a Facebook page that we're constantly updating with these videos. We put all the videos from our radio shows on our Facebook page, and anything that's going on in the office. Sometimes we'll have events and promotions going on, and so that's a great place to look and see if there's anything new. And we have somebody in the office, Shalene, who does a great job of keeping that up to date, and she keeps us up with the times.
Yes, she's very good at that.
She's great.
Got a couple of minutes left. We have a caller with us. Caller, you're on the air with Jeremy Daly, physician assistant.
Good morning.
Good morning.
Do you ever advocate or suggest more natural prophylactics for toughening up your system, so to speak?
Do you have any specific examples that you
Honey,
were?
local honey.
Oh, definitely. Local honey is amazing for a lot of reasons. One, because a lot of the natural allergens are in there, and so I think that's actually a great way to help desensitize yourself in a lot of ways. And the amazing thing about honey is that it has a specific antibody in it. It's called IgA antibody, and it's actually really great for wound healing, and seasonal allergies for people that have moved to a new area and they're having allergies. That's a great point to bring up. I think that it's really effective, actually. So thank you for bringing that up.
Tastes really good, too.
That's true.
We have about a minute left. You wanted to mention you can allergy-proof your house. You mentioned filters and purifiers, pets, obviously, that you might be allergic to. But here's one that caught my attention. Stuffed animals, and I think sometimes, too, pillows, because these things are dust collectors, and yet sometimes there are things stuffed inside them when you buy them new that can cause an allergy.
No, definitely. Yeah, if you have a kid that's struggling with allergies, the first thing that I want you to do is look in their room, look in the environment there. Do they have a dog that sleeps at the foot of the bed or under the bed? That's leaving a lot of the pet dander on the carpet. Um, really the allergens in the pet dander come from saliva, from the urine, and from the skin of the animal. And so that's the first thing I would say is look in the room. If they're stuffed animals, make sure that they get thrown in the dryer every week. That way they can take off some of the dust mites, kill the dust mites, and things do collect on those stuffed animals. And so that's something that we see often. Or if your child can part with those, that would probably be a better option.
Yeah, sometimes that's not easily done, though.
No, it's not.
I can recall a few of those battles. Jeremy Daly, we want to thank you for coming by today.
Thank you.
And if you didn't get through today, remember, I've got a caller who's waiting on the line, but if you didn't get through today, give the office a call. What's the number there once more?
It's 933-4400.
And again, Tripp Family Medicine, Better Health with Tripp Family Medicine on Wednesday mornings between 8:30 and 9 o'clock, right here on News Radio 1310, KLIX, and newsradio1310.com. It's 49. I believe we might be talking a little City Hall expansion and the like coming up following news at 9 o'clock. One more hour of Top Story with Bill Colley just ahead.